the WHO headquarters in Geneva. Welcome to our COVID-19 press briefing today, this Monday, July 27. As normal, our Director General, Dr. Tedros, will open the briefing with some remarks, and then we'll open the floor to questions. Today, joining Dr. Tedros, we have our regular experts, Dr. Mike Ryan, Executive Director of Emergencies, and Dr. Maria Van Kerkhoff, our technical lead for COVID-19. But we also have with us today Dr. Mariangelo Simao, our Assistant Director General, Access to Medicines and Health Products, and also Dr. Meg Doherty, Director of our Global HIV, Hepatitis and Sexually Transmitted Infections Program. As usual, we'll be providing simultaneous translation in all 6 languages, 6 UN languages, plus Portuguese. And it will be coming to you across all our social media platforms. And now, without further ado, I will hand over to Dr. Tedros. Dr. Tedros, you have the floor.
Thank you, Margaret. I think you have already accepted my name then. Thank you. Good morning, good afternoon, and good evening. This Thursday marks 6 months since WHO declared COVID-19 a public health emergency of international concern. This is the 6th time a global health emergency has been declared under the international health regulations, but it's easily the most severe. Almost 16 million cases have now been reported to WHO, and more than 640,000 deaths. And the pandemic continues to accelerate. In the past 6 weeks, the total number of cases has roughly doubled. When I declared a public health emergency of international concern on the 30th of January, the highest level of alarm under international law, there were less than 100 cases outside of China and no deaths. As required under the international health regulations, I will reconvene the emergency committee later this week to re-evaluate the pandemic and advise me accordingly. COVID-19 has changed our world. It has brought people, communities, and nations together and driven them apart. It has shown what humans are capable of, both positively and negatively. We have learned an enormous amount, and we're still learning. But although our world has changed, the fundamental pillars of the response have not. Political leadership and informing, engaging, and listening to communities. And nor have the basic measures needed to suppress transmission and save lives. Find, isolate, test, and care for cases, and trace and quarantine their contacts. Keep your distance from others, clean your hands, avoid crowded and enclosed areas, and wear a mask where recommended. Where these measures are followed, cases go down. Where they are not, cases go up. Countries and communities that have followed this advice carefully and consistently have done well, either in preventing large-scale outbreaks like Cambodia, New Zealand, Rwanda, Thailand, Vietnam, and islands in the Pacific and Caribbean, or in bringing large outbreaks under control like Canada, China, Germany, and the Republic of Korea. These are just a few examples, but there are many more that could have been listed. The bottom line is that one of the most fundamental ingredients for stopping this virus is determination and the willingness to make hard choices to keep ourselves and each other safe. Over the past 6 months, WHO worked tirelessly to support countries to prepare for and respond to this virus. I'm immensely proud of our organization, WHO, and its people, incredible people, and their efforts. Within days of learning of the first cases